It's funny. We have all these dashboards for our cars, our phones. We check everything. But for our own bodies, we usually just wait for a warning light to come on before we, look under the hood.
That's so true. And today we're looking at that first most important check, the full blood count, or FBC.
Exactly. And our deep dive today is based on some great info from Blood Test UK.
Right, and we're looking specifically at how this works for people right there in Wolverhampton.
So our mission is pretty simple. How can a tiny bit of blood stop a big sickness before it even starts? Let's get into it.
Let's do it.
So when Blood Test UK talks about a full blood count, what are we actually counting?
Okay, so think of your blood as having three main workers. First, you've got your red blood cells.
Those are the delivery guys, right?
The delivery guys, exactly. They carry all the air, the oxygen to your whole body.
So if you don't have enough of them, you'd feel tired.
Very tired. That's a condition called anemia. Then you have your white blood cells.
The body's security guards.
Yep, they fight off germs and sickness. And the cool thing is, the test can even give clues about what kind of germ it is.
Oh, wow. Okay.
And third, you've got platelets. They're like the repair crew.
The ones that stop you from bleeding when you get a cut.
That's them. They rush in and plug up the hole.
So you've got your delivery, your defense, and your repair crew. Why is looking at all three so important?
Well, because it's an early warning system.
Yeah.
Blood Test UK points out that this is often the very first place a doctor sees a problem.
Before you even feel really sick.
Long before. Which brings us to Wolverhampton.
Right. The source mentions a story about a woman, let's call her Sarah.
Yes, and her story is really common. She just felt tired. All the time.
Something a lot of us would just blame on being busy.
We all would. But she went to a local clinic there in Wolverhampton and got an FBC test.
And it wasn't just being busy.
Not at all. The test showed her red blood cells were low on iron, a clear, fixable problem.
It gave her an actual answer instead of a guess.
And that's the whole point. It gives you real information to act on.
Okay, so let's talk about how it works. I'm going to a clinic in Wolverhampton. What do I need to do?
It's super simple. A nurse just takes a very small sample of blood from your arm.
The whole thing takes, what, a few minutes?
Just a few minutes. Now, Blood Test UK does say you might need to fast. So no eating for about 8 hours before.
The fasting part. Does it really make a difference?
It can, yeah. Eating can make your blood a little cloudy, and that can sometimes make it harder for the machines to count everything perfectly.
Okay, so it's about getting the clearest picture possible.
Exactly. And you should also drink lots of water.
Good tip. And in Wolverhampton, how long until you get the results? Are we waiting weeks?
No, it's really fast. Usually you'll hear back in a day. Sometimes even faster if you go to a private clinic.
That's amazing. So who should be getting this done? Is it just for people like Sarah who already feel unwell?
Not at all. It's actually a great checkup for anyone, just to see what your normal is.
So you have a baseline.
You've got it. It's also really helpful for, say, older people to check their vitamin levels, or people with conditions like diabetes.
And the local labs in Wolverhampton, they're all following strict rules to make sure the results are right.
Absolutely. The standards are very high, so you can trust the numbers.
So to sum it all up, the FBC is a simple, quick way to look inside your own body and keep it safe.
It really is. Taking care of your blood is like, well, taking care of your whole life.
So here's a thought to leave everyone with. If one tiny drop of blood can tell us so much about our health, what other signals is our body sending us right now that we might be missing?